While most people don't necessarily look forward to going to the dentist, most would likely agree that it's better than not going at all. And unfortunately, particularly during this pandemic, that's what's happening for many people, often due to cost. It's got some dentists quite concerned and revived the conversation about whether dental care should be covered under the provincial health insurance system. Here for their perspectives, from furthest away to closest to our studio, as is our custom, we start in Kitchener, Ontario with Dr. Christina Heidinger. She is chair of the Political Action Committee at the Ontario Dental Association. In Mississauga, Ontario, Dr. Kal Khaled, president of the Ontario Alliance of Dentists, and in the provincial capital, Dr. Carlos R. Quinonez, professor and director of the Specialty Training Program in Dental Public Health at the University of Toronto's Faculty of Dentistry. And we're glad the three of you could spare some time for us tonight on TVO. Dr. Khaled, why don't we start with you? What government-funded dental care programs exist in the province of Ontario right now?
There are three major programs. ODSP for low-income Ontarians.
Ontario Disability Support Program.
Ontario Disability for disabled individuals. Ontario Works for what we may call welfare recipients. And Healthy Smiles, which is a program that the government set up several years ago for children who have parents with financial limitations, so they can get dental care from the local dentist, and the ministry will cover that cost.
So essentially we're talking about people who have disabilities, we're talking about people who don't have jobs, and then the Healthy Smiles are for the kids. Is that right?
That's correct.
Okay. And just basically explain how it works. If you come under one of those three, or if you are in one of those three buckets, you go to the dentist and what happens?
You need approval initially by your worker, let's say under the first two programs, or a municipal office examines you, a dental center that's affiliated with the municipal government will check the child. But essentially, you get a card or a form or a letter saying that the government will assist you with dental care. You take it to a dentist who accepts that particular program, and not all do, but you take it to a dentist who does. The dental work is completed, and the dentist files the paperwork and gets payment after a period of time.
Okay, Dr. Heidinger, why don't you pick up the story? How long do dentists typically have to wait for the government to reimburse them for the service that they provided?
Every situation is a little different for each office. If you have signed up with a direct payment, you'll get the payment within a few weeks. If you have to do paperwork and send it off, it can take longer than that.
Do you find that an acceptable amount of time to wait?
Not necessarily, because in my office, when patients come for their dental care, it's like your grocery store. You pay at the time of your dental care. And if they have dental insurance, oftentimes their dental insurance is reimbursed within 2 or 3 days afterwards.
Okay. And you just mentioned or I guess it was, Dr. Khaled, who mentioned a second ago that if you are a dentist who accepts patients who are, for example, on ODSP or Ontario Works, is that to suggest that there are lots of dentists out there who will not accept patients in one of those three buckets?
There will be some dentists that don't accept them. I believe at the last time the Ontario Dental Association did their survey, there was still, I'm going ballpark here, 60-70% or more that would accept those patients. The other thing is sometimes you have those patients initially, and then they go on disability, or they have to use Healthy Smiles for their children. So I'm sure some of most dentists would keep their patients. The patient-dentist relationship is generally strong.
All right, Dr. Quinonez, maybe you could help pick up the next part of the story. Why are there apparently so few dentists? Admittedly, the majority are in, if Dr. Heidinger's numbers are right, but why would so few dentists accept patients in those three buckets?
So I'd actually just like to add a couple more buckets, if you don't mind,
Sure.
before I answer that question. We're also missing the Ontario Seniors Dental Care Program, which is a new program specifically for low-income seniors, which was announced roughly about 2 years ago now. And that is mostly delivered through the public sector, meaning by public health unit clinics. And then there's also services covered under OHIP, surgical dental services delivered in hospitals. So there's a variety of programs, but in general, I think we are touching upon the major ones from the point of view of dental care delivery in the private sector or private practices. Now, as to why dentists might not accept these patients, as you said, the majority still do, but there is a significant minority that don't. And I would argue that it's an issue of financing, of costs. Public programs tend to pay lower than the suggested fee schedule for dentists in Ontario, and that puts stress on dentists in terms of being able to cover their overhead costs, for example, which limits their willingness to accept such patients. We've done research in the past to ask why, what are the limitations here? And again, financing is important as well, which has been mentioned as complicated paperwork. And last but not least, patients, I do not like using this term, but I'll use a term that is often used, patients that are non-compliant. So I think there could be...
Sorry, what does that mean, Dr. Quinonez, non-compliant?
Patients that aren't showing up to their appointments on time, patients that aren't covering or aren't following the advice given by the dentist, for example. And again, I really don't like using that term because there's a lot of things going on in these patients' lives that add good explanation for why these challenges exist. And then ultimately, what I was going to say is that there can often be a cultural disconnect between the lives of these patients and then the lives of dentists, which can create some tensions. So in general terms, I think that those are the reasons for why dentists might not always be willing to accept such patients.
Gotcha. Now let's follow up on the first part of your answer there, which had to do with the money. And Sheldon, have we got this graphic standing by? Because we want to have our viewers understand the distinction between what the Ontario Dental Association has determined the cost of various services are versus what the Ontario government is prepared to reimburse for, and we'll just do one bucket here. These are people who are part of the Ontario Disability Support Program, ODSP. So here we go. And for those who are listening on podcast and who can't see this chart, I'll read out the numbers so you can hear them. For a complete oral examination, the Dentists Association say that costs $148. However, you're only going to get reimbursed $76 by the province. Let's do another. One surface, for example, tooth-colored molar filling, $200. What's the province going to reimburse? $57. Shall we do another one? Complicated tooth extraction. Okay, the Dental Association says that costs $260 to do, and the province is going to reimburse you less than $90 for that. These numbers, incidentally, all from the Ministry of Children, Community and Social Services. We're not making them up. This is strictly from the province and from the Ontario Dental Association. So, okay, I'd like to next understand, Dr. Khaled, maybe you can pick up the story. The Dental Association says, here's what it costs to do these procedures. The province says that's all well and good, but we're only going to reimburse you this much. Why is there such a wide gap between those two numbers?
My assumption is, and Dr. Quinonez will know more, but my assumption is that the ministry has limited financial capability. The Ontario budget is put out. They spend a lot of millions and billions of dollars with the Ministry of Health, obviously, and other services that the government provides. It's been many years since these fees have been increased, by the way. That's another thing you should note, that Healthy Smiles and the other programs have not significantly increased their fees in over a decade, I believe, and we all know that inflation rates are significant, especially over this last year. So I believe it's just to manage an issue of budget. Does the ministry have the funding it needs to increase these fees? That's the bottom line.
And Dr. Quinonez, is that gap the reason why as many as 40% of Ontario's dentists will not see patients who are in those buckets we talked about earlier?
Well, again, I think it's more than just money. But if we're concentrating on payment, I agree. Public dental fees have not increased at the same rate as private dental fees. I'm not saying that they should, but I do think we need to think about fair remuneration for dentists in order to improve the utilization of dental care and access to dental care for these groups. But I would also say, is it really that we don't have enough money? I think there are challenges there, but I also think we need to think about political will. Is there the willingness by by leaders to sort of to say we need to invest in this area. There was political will around doing something for working poor children, and that's what's resulted in Healthy Smiles Ontario. There was political will to do something around low-income seniors. That's what resulted in the Ontario Seniors Dental Care Program. And now I think, hopefully there will be political will to help address many of these issues, of which a fair remuneration is one aspect, but there are many others.
Well, let's just, before we get to the political will story, I want to understand those numbers in the first column better. So Dr. Heidinger, come on in here and say, I mean, these numbers didn't come down from Mount Sinai, right? The Ontario Dental Association, in its wisdom, determined here's what it costs to do these procedures, and the government said that's all well and good, but this is all we're going to give you. Now, how did you come up with the numbers in the first column?
Okay, so you've got two comments going on in there in that question, but the first one with regards to the fee that comes in the first column, the Dental Association for many years has put out a fee guide that is based on the economy in Ontario, and it's right across Ontario. They do analysis of dentist submissions of their financial statements and of their overhead and of the labor costs. And every year they do an analysis and they take into account the technologies that are involved, the costs of doing the business, if there's environmental costs, or, this past year we've had the PPE added in there. And then they work their magical numbers and they come up with an increase. Surprising enough, a lot of the times the increase is similar to your cost of living, but that's what the increase. And some costs will increase more than others, depending on what the treatment standards are at the time. So that's where our numbers come from.
Okay, let me ask Dr. Quinonez the follow-up here. Forgive me, I want to get the follow-up from Dr. Quinonez, which is, okay, that's what the Dental Association says is a reasonable amount of remuneration for a service provided. Do you think those numbers are legit, or is there some padding going on, or what? You tell us.
No, I think those numbers are legitimate, but I think you have to understand when you have a provider group creating a suggested fee schedule, it's not that anybody's padding, but, taking into account labor costs, capital infrastructure costs, making sure that the dental care, specifically in relation to things like COVID, is delivered safely and effectively. So we have seen increases in costs in terms of supplies like personal protective equipment and all the other things the dentists have had to do. But there's also issues of profitability, right? There's income expectations. Dentists are just like any other human being. They set targets on what they want to make, how they want to live. And I would argue that that's appropriate. Now, the issue is whether the difference between the private suggested fee schedule and what public payers are willing to pay, whether that delta is challenging or problematic. We know it is for dentists. It has implications for access to care, but now hopefully we get the political will to sort of get us to a better place. So, for example, my research group did a review of public fee schedules across the country, compared them to the provincial or jurisdiction's private fee schedule. And, you get a wide range in public programs, but on average, we'll say that public dental care programs will pay anywhere between 40 to 60% of private fee schedules. It can vary quite dramatically. My sense is, and sort of the literature tends to support this a little bit, the evidence isn't great, but it tends to support this, that if you get to about 70% or just thereabouts, dentists are more willing to play ball because that's seen as fair remuneration. And dentists, remember, are trading off their professional responsibilities against this. So they'll say, yeah, I'll that's fair remuneration, and I'll do what it takes to meet my professional obligations to provide access to care for the population. So it's a set of complex issues that I think require some investigation.
All right, let's do a little real-life investigation right now. Dr. Khaled, you presumably had to incur additional costs when the pandemic hit. Can you explain to us how that pandemic affected your practice?
In so many ways, to be honest. Number one, if you want to talk about additional costs, yes, we've sealed our our operatories, our rooms, air filters, increased costs in PPE. So the average dental practice may have incurred costs of $20,000 to $50,000, let's say, in the initial capital improvement and then running costs. So our costs have increased, and Dr. Heidinger's right. The Ontario Dental Association does a good analysis. By the way, we actually submit anonymously, I suppose, our actual financial statements to the Ontario Dental Association, so they're not making up these numbers. They actually look at our actual financials, they look at our profit and so on, and so their analysis is quite rigorous. I must say there's a couple of things that I just want the listeners to take note of. Number one, dentists do have a responsibility to the public, and we take this responsibility very seriously. Someone told me the other day, he said to me, why don't you guys go on strike? Just like, in a sense, the optometrists are trying, I won't say they're on strike, but they're limiting their access to care, perhaps rightly. We can't. During the 3-month period when last year, or those 3 months, April, May, June, when we were somewhat closed, my office was one of the few offices open. We saw significant dental problems. I mean, people who couldn't eat, people who couldn't sleep. We diagnosed 2 oral cancers, abscesses. So we take our job very seriously. Dentists do have a responsibility to the public, and they are well aware of that. But we just feel that it may be better for the public in a couple of different ways, in many ways, if their remuneration was increased finally after decades. Someone told me that the Ministry of Health will spend $5 to $10 million on treating dental emergencies in hospital emergency rooms. And I thought, that's interesting. That's a big number. If they realized that, patients who aren't being seen at their private dentists go to the dental emergency, go to hospital emergency rooms where they receive some care. If that funding was removed from the Ministry of Budget to the hospitals and added into this program, it would probably get a much bigger return, for example.
Right. Well, first of all, we appreciate your conscientiousness staying open during that time, and I'm sure many of your patients were extremely grateful. I do want to know how did you assume a $50,000 unanticipated cost to improve your working circumstances as it related to the pandemic? That sounds like a big nut to have to crack.
In my particular office, it was $25,000. There was government grant assistance, as you may recall, for small businesses.
And you were eligible for that?
Yes, most of it's loan. I believe it's paid back over the next couple of years. First of all, the cost, as the others have noted, of PPE, a box of gloves, for example, used to cost us $25 for one of those boxes. It hit a cost of $72 during the high point of the pandemic, and we needed more of them, not less of them. Prices have come down, though, with the world kind of improving. But there is added cost. There is added cost, and again, dentists, as all the listeners know, do have above average income, generally speaking. So no one's really complaining from that point of view. We just feel that 50% of the fee is cutting it pretty tight. And as Dr. Quinonez said, if it hits 70, 75%, I think more and more dentists will accept it. By the way, as Dr. Heidinger said, maybe 50 to 70% of dentists do accept public monies for treating patients, but a far fewer number of dental specialists will. It's probably closer to 5 to 10% of specialists will accept these programs. So that also limits care.
So if I understand you, dentists don't mind taking a haircut on the fees, they just don't want to take a huge haircut on the fees.
Yes, and like my hair here, yes,
Gotcha.
Exactly.
Okay, sir, that was not meant as an insult to you, I assure you. Dr. Heidinger, I want you, if you would, to comment, because we asked the Ministry of Children, Community and Social Services to participate in this program. We hope that they would give us somebody who could come on and discuss this issue with you, and they declined the invitation, which is their right to do. The spokesperson for the ministry also said the ministry doesn't track which dentists provide which services and to whom. And they did send this statement over. They said, we continue to roll out a more responsive, efficient, and person-centered social assistance system that will help individuals and the economy recover from the COVID-19 pandemic. What do you make of that?
I'm not really sure what to make of that.
Does it sound like bureaucraty's gobbledygook to you?
Yeah, I think so. I'm not sure if they were they were wanting to prove that they are looking after the situation without knowing too much what's going on about it. I'm not really sure exactly what that statement meant. Sorry.
Okay, well, I suspect you're not alone in that. Tell me this, though. Has the Ontario Dental Association tell me, how hard are they lobbying government to get some changes in the fees?
We've really picked up the I hate to say battle, but the conversation again. I mean, during COVID, we dealt with the government on different levels because of the pandemic. In September, we started with a letter saying that we wanted to meet with the Ministry of Health. Before COVID started, we had an agreement with Premier Ford saying that we would get together and try and solve this issue. We're in a campaign right now where a lot of our political contact dentists are out talking with their MPPs about this issue, discussing numbers, showing them graphs. We're trying to address the healthy smiles first, and then once we get that addressed, then we can go on to solve on the other programs that are out there.
Okay.
So, hospital. Yeah, go ahead.
No, I just wanted to ask Dr. Quinonez, at the end of the day, I guess this raises a bunch of questions about whether or not dental care, essentially for everybody, or at least for everybody who's not insured at work, for example, ought to just simply be included in OHIP, the Ontario Health Insurance Plan, so that going to the dentist would essentially be the same experience as going to your general practitioner or going into the hospital for a procedure, whatever. What's your view on that?
Well, as a person who specializes in public health, or as a dentist that specializes in public health, I obviously think that dental care should be included in our universal system of health insurance. But I think there's a lot of nuance here. What dental care? Where would that be delivered? I think people react to this emotionally as Canadians. Well, of course, that makes perfect sense. But I think a lot of investigation, or we need to look much more clearly at the details here, because there is some dental care that it doesn't really make sense for it to be included in a public basket of oral health care services, for example, whereas the treatment of pain and infection, the prevention of disease, the restoring of chewing and of social function, for example, your teeth are very important for your life in general. I think the issue then becomes what services, and I think again the devil's in the details, and these are the hard types of debates that we need to have in order to arrive at a place where we could think of how might dental care be included in our universal system of health insurance, or to ask a more, I would think, a more specific question, how best to deal with dental care in Canadian healthcare policy. I caution against the idea that, let's just include it, because I just don't think it's that simple.
No, I get you, but let me do a real life example here. If you have your wisdom teeth taken out and you have it done in the hospital, I presume OHIP's going to cover that, and you don't have to reach into your pocket. But if you have the same procedure done in a dentist's office, I presume either you are or your own private insurer is going to have to pay for it. It's the same procedure. It's just it depends where you have it done. That's the difference in costing. Does that make sense to you?
No, it doesn't. And this is specifically getting to the point I'm saying. It's actually not a fait accompli that if you need your wisdom teeth taken out for legitimate reasons, let's just say an infection or some type of cyst or tumor, that would in any case even be done in a hospital. So if it is done in a hospital, it's not again a given that it's going to be covered by OHIP. But as to the issue of wisdom teeth, a prophylactic removal of wisdom teeth, or just removal of wisdom teeth for any reason other than infection or the issues that I mentioned previously, isn't necessarily indicated. So it's again getting at exactly what services. So let's deal with another service. If you need a root canal because you have a very serious tooth infection, to me that is definitely within the remit of the public purse, if I could put it that way. And again, whether it's done in a private setting or in a public setting, to me there should be some support for that, whether it's targeted to low-income individuals or people experiencing social and economic marginalization, or to everybody. I'm of course I'm leaning towards everybody, because this to me is a health concern. So just to say that it makes no sense to me and to many other people why the teeth would be excluded from this universal basket.
Right, teeth are
But
part of
again,
health. Healthy teeth are part of health.
100%. But
Yeah.
how it's done, I think, requires a lot of thoughtfulness.
For sure. With a few minutes to go here, okay, here's a little tricky question. Dr. Khaled, let's acknowledge that because this is now a political dispute, you need to deal with politics, and a lot of politics is optics. And I want you to speak to, if you would, the optics of reasonably well compensated dental professionals turning away some of the most vulnerable people in our society because of a dispute over fees with the provincial government. How does that look?
Obviously wouldn't look good, but let me make that clear that in speaking to hundreds of dentists through the last few months and years, I haven't had one dentist say to me that that's the protocol they would like to use. We do not believe that withholding dental care will accomplish anything, because in the end, the premier won't suffer, the minister won't suffer. It'll be a poor individual that'll suffer. So that is not on the table as far as I'm concerned. And I honestly haven't heard any dentist even suggest that. On the contrary, as times get tougher economically in Ontario, I've had more dentists say that they wish they could see more people in need of care. There's one other point as well. The Healthy Smiles program, which is for children, it used to be called Children in Need of Treatment, is a program that was developed to protect children's health, obviously. But there is supposed to be a test of parental income. If they're above a particular level or they have dental insurance from work, they're not covered. We're finding more and more, though, that it's not well supervised. For example, I have high-income individuals coming in with their children with the documentation, so I have to provide them with half-price sort of.
How does that happen?
Care.
If they're making too much money, how do they get eligible for that?
Well, that's the question. There is, as Dr. Quinonez said, the devil is in the details, really. There are ways of getting around the system we've discovered where I have, as I said, high-income, and I know they're high-income individuals bringing their kids in. They might not have dental coverage. Maybe they're self-employed, high-income individuals. So we'd like to see things tighten up a little bit, especially in the Healthy Smiles program, where really it's people who need it are taken care of. So as to your first point, as I said, and I want to make it very clear that we are not considering withholding services under any circumstance.
Well, let me follow up on that, because you talked about it already. The optometrists are in the middle of a very nasty fight with the province of Ontario as well over their remuneration, and some of them have decided they're just not taking various patients for various procedures. Go to the hospital emergency department and let them figure it out, has been their approach, and we understand they feel they are dramatically undercompensated for services that they're providing. What have you learned from their situation?
You have to realize they are in a slightly different circumstance where they're actually not allowed to see anyone. For example, anyone above the age of 65 is covered by OHIP. Under federal or maybe it's provincial law, you cannot charge someone over 65 a fee to come to your office. So because it's a covered procedure under OHIP.
Okay, but what have you learned from their struggle that helps you in yours?
I'll give you an example. I went to an optometrist recently in Oakville. She spent over an hour with me. The bill was under $100. And I was quite surprised, actually. I felt that it was too low for the amount of work that she put in. So I do understand where they're coming from. Fortunately, very fortunately, very few people will die from poor vision. You know, I'm sure there's eye infections that optometrists do not deal with anyways. But in our case, there are cases in Canada every year where individuals do die from dental abscesses. So it's a slightly different scenario between us and the optometrists.
Gotcha. I want to thank the three of you for coming on to TVO tonight, and we now know a little bit more about not only the optometrists, but the dentists' fight with the Ontario government as well. Dr. Khaled, Dr. Heidinger, Dr. Quinonez, thanks so much.
Thank you.
Thank you.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.